Pre-show, we were talking a little bit with you, John, and you had actually heard on, another station that the risk factors that are out there and some of the things that are going to happen with all this advertising about doing this genetic testing done. And we mentioned a little bit, too, about women are going to run out and probably get mastectomies and this kind of things done more frequently than what necessarily needs to be done. So,
not to interrupt, so the question then, it sounds like, how do you straddle between caution and hysteria with something along those lines? Because it is easier to glom onto a misunderstanding of a massive study in a 30-second soundbite. And that might be the hang-up. And so people err on the side of caution and or hysteria. Is that what's going on? Or do you expect that to be what will happen?
And you working in the public safety system, you see this every day out there, that people that hear this little clip out there, like you said, in 30 seconds. And most people, to be honest, that are diagnosed with breast cancer have no family history of it at all.
Okay.
We talked a little bit about that last week on the show. And one thing that we mentioned, Bill, is about this testing and who needs to have this testing done and some of the family risk factors out there. Now, if your mother's been diagnosed with breast cancer under the age of 50, you got a sister that's been diagnosed with breast cancer, absolutely. You probably should come in and have this testing done so that you know. And it doesn't necessarily mean that you come in and have this testing done. You actually need to have genetic counseling done. You need to have this test explained to you. What are your risk factors of having it done? And it's not a test that everybody needs to have done. And what are some of your guidelines over at Pathway Genomics for this testing to be done?
We actually have, to talk specifically about that, we actually have a questionnaire that's specifically for this test, these two tests, I should say, for the BRCA1 and 2 test, which is called BRCA-True with us. And then the BreastTrue test is for high-risk patients. Higher risk patients is what I should say. Basically for those patients that have either tested negative for the BRCA1 and 2 or who have not been tested yet but feel like they have a significant risk within their family genome. And what I mean by that is, yes, it's common knowledge that if you have a family member or family members who have had or who have died from or that have gone into complete remission of breast cancer, then yes, you should be tested. However, there are other cancers that are associated with these genes, not just the BRCA1, but the other ones that I mentioned before, that if you have these genetic mutations, these mutations are responsible for other cancers as well, such as pancreatic, prostate cancer, cervical, and so on. So if you have not just breast cancer in your family, but also those other cancers that I mentioned and some other ones as well, this is important. Why? Because that tells us that you're at significant increased risk for having not just BRCA1 and 2 mutations, but other ones as well that can give you cancers. And if you have these cancers, insurances should be allowed to pay for these types of tests. Why? Because you're the type of patient that should be getting this to find out if you're at higher risk, so that somebody like Dr. Thomas can say, hey, you need to be looked at more frequently than, say, someone who doesn't have these mutations.
So, question then: does that apply to men and women?
Sorry, go ahead.
It does. It does, John. It does apply to men and women, and there have been studies out there that show that men that have even tested for this genetic mutation are at just as highest risk, and it's even associated with prostate cancer in men.
That he's correct. If you have this type of mutation or mutations, in general, if you have more than one of these mutations, it's not considered a survivable event. And the reason why that is because if you have more than one mutation of any one of these genes, your body can't survive. It needs these enzymes, these proteins throughout your body in order for your cells to thrive. If you have more than one of these mutations, your cells wouldn't survive. You would not be here today. So generally, you only have one of these mutations, excuse me, and that mutation allows you to be able to get breast cancer or ovarian, cervical, whatever the case may be. Prostate, pancreatic, whatever the case may be. Even gastrointestinal cancers as well. So if you have one of these mutations, ultimately the question becomes, what do I do different than I did before?
Right.
And in general, most practitioners say, hey, I want to follow a different regimen, a different treatment schedule, or a watching schedule than I would normally, i.e., let's say you don't have any family history. Well, the normal guidelines would say, and this is an arbitrary statement, would say, okay, at the age of 40, a man needs to get a prostate exam. Well, if you have a family history of prostate cancer, you may want to do that earlier and significantly more frequent. Why? Because you want to catch it in this early stage to remove that threat or significantly reduce that threat.